For tonight's manager's report, I would like to start with a staffing update. After a nationwide search and an extremely competitive interview process, I am happy and delighted to announce the appointment of Dr. Kimberly Scott to serve Appoint Dr. Scott to serve as our new Public Health Director. As you all know, Dr. Scott is no stranger to this organization or community, as she has served as the interim Public Health Director for the last 6 months. Since joining Mecklenburg County in 2022, she has helped transform public health's approach to community health improvement by advancing collective impact, strengthening community engagement, and fostering partnerships that bring residents, organizations, and institutions together to improve health outcomes. An exemplary leader, Dr. Scott has more than 15 years of experience leading efforts to protect and improve community health through strategic leadership, collaboration, and population health initiatives. As interim health director, she led a team of nearly 1,000 public health professionals in improving the quality of life for Mecklenburg County residents to several outbreaks, including measles, cyclosporiasis, and several other communicable diseases impacting our community. Prior to her interim director role, Dr. Scott served as Mecklenburg County's Assistant Health Director for Population Health, providing executive leadership for countywide public health strategy, community health improvement, strategic partnerships, along with violence and chronic disease prevention. She is well respected and recognized for her work, and I am so confident that Dr. Scott is the best public servant to sustain excellence at public health and even take it to the next level. Before joining Mecklenburg County, Dr. Scott held leadership roles in local government, nonprofit organizations, research and academia, leading multi-million-dollar initiatives focused on improving population health. Her career pathway included health leadership in Wake County and senior leadership at a nonprofit in Georgia. As many of you already are aware, in Mecklenburg County, Dr. Scott is actively involved in numerous professional, civic, and nonprofit organizations, serving in leadership and advisory roles that support public health, education, and community development. Dr. Scott is a proud graduate of Albany State University, where she earned a Bachelor of Science in Biology, and Georgia Southern University, where she received a Master of Public Health and Community Health. Dr. Scott earned her Doctor of Public Health and Public Health Leadership from the University of South Florida. Dr. Scott is a highly respected leader with the public health teammates. I know they are not surprised that while we looked across the country to find the best person, Dr. Scott was right here with the organization. And as a matter of fact, I can assure you that many public health department employees, some of them are here tonight, are so thrilled about this announcement. She is someone they trust, admire, and consider the strongest of teammates. I'm sure they have been quietly rooting for today's announcement. Secrets out. At this time, I ask that you please join me in welcoming our new Public Health Director, Dr. Scott. Yes. Come on down.
First of all, I'd like to say thank you to County Manager Bryant for those wonderful words. And thank you to the Board of County Commission, Mecklenburg County residents, partners, our amazing public health staff. It is an honor to be your next public health director. 48, that's the age I lost my father. It was unexpected. I remember the grief, the birthdays missed, the holidays that didn't feel quite right, the milestones where I saw an empty chair that had never been filled. At that time, I did not realize that that was sparking my passion for my life's work. When you lose someone soon, you begin to understand what public health is. It's about giving families more time together, more birthdays, more holidays, more ordinary Tuesdays around the table to have dinner, more memories with the people that you love. So for me, public health was never simply about a position or a role. It's always been personal and a passion. My journey in public health started as a high school peer educator in rural Georgia for a teen pregnancy prevention program. I had no idea that that opportunity would lead to my lifelong calling. My first professional role was as a health educator in rural Georgia, working at an innovative teen public health department center to focus on investments in young people through summer programs, mentoring, educational opportunities, and evidence-based initiatives to make sure that young people had bright futures. That experience lit a fire in me. So since then, I've had the opportunity to work across Georgia and the state of North Carolina alongside incredible partners, people, and community members to expand access to preventive cancer screenings, improve maternal and child health, reduce teen pregnancy, and strengthen neighborhoods, all to bring communities together to form a healthy and bright future. None of that happened overnight, because real progress does not happen overnight. It happens through relationships, through conversations, community by community. It takes listening, it takes trust, it takes evidence, it takes perseverance. Long before I ever chose public health, I had incredible examples of what service looked like. My father served as a law enforcement officer, but in our small community, he was so much more. He was a basketball coach, a mentor, and someone who believed every young person deserved the opportunity to thrive. Even today, people still share stories with me about how he changed their life. My mother, who is here today, dedicated her career to education in our small town. It often felt like she taught half of the community. To this day, it's hard to go to Walmart with her because everybody knows her in our hometown. But she challenged them to believe in themselves and exceed their own expectations. My grandmother broke barriers as the first Black woman to serve as her city council representative in her community, showing me that leadership is about serving others with courage, humility, and conviction. And tonight, I'm especially grateful that my sister is also here with me, who has been one of my biggest supporters, encouragers, and constant reminder that no matter where life takes us, family is our foundation, and quite frankly, my best friend. So looking back, I realized that service was not just something that my family did, it was the language we spoke. It was modeled around our dinner table, at our church, and lived through our community. These lessons have led me here to the community that I proudly call home. I inherit an extraordinary department that I'm so proud of. We have an internal mantra of being a 5-star public health department. But today I'm proud to say that we are ready to build on that foundation and imagine our public health department without limits. So as we look ahead, my commitment is simple. We will build on our remarkable foundation. We will continue to follow the data and evidence. We will strengthen our partnerships. We will embrace innovation. We will invest in our people. And most importantly, we will listen to our community. We are not defined by the challenges before us, but how we respond to them. So to our public health team, I thank you. To our community partners, I thank you. To this outstanding board, I thank you. The road ahead won't be easy, but public health is changing rapidly. We know that we'll have difficult decisions and face new challenges, but I want you to know this, I'm ready. I understand this responsibility and what comes with this role. And with that, I say thank you, and I'm proud to serve you all.
Dr. Scott, can you come by so we can? Mom and sis, can you all come down? Yeah.
I like that.
We'll take a picture. We'll do the comments. We'll do the comments.
So happy for you. I'm so excited. Congratulations. God bless you.
All right, cuz. Thank you. Congratulations.
That meant a lot.
Congrats.
It's so beautiful, and I know your father's just watching you right now.
Congratulations. Mother is the star. So is the sister. Like it matters. Job well done. Congratulations.
Representing Middle Georgia well. Congratulations.
Where did you teach in Georgia? Milledgeville. Well, my mom's from Tifton.
She's up the road from Macon, Georgia.
Yep.
You did great. I can tell you're a great mom. Wow. You can smile. Thank you.
There's a lot of Georgia up here. That's right. All right. Kind of center.
My dad's so happy she's crying.
All right, big smile, everybody. Eyes up. Thank you. Two more. Thank you.
All right.
So we definitely can't let this moment pass without some comments from board members, because I know everyone is burning. We're gonna keep it to 60 seconds though, so we can keep the meeting moving. Let's start with Commissioner Powell.
Well, I told Dr. Scott, thank you for sharing your story. It means so much to know, like, the core of your passion. And I know I wanted to say something else, but keep sharing. Thank you. That's all.
Commissioner Dunlap.
Thank you, Mr. Chair. I told Dr. Scott, I woke up with her in my spirit this morning. We oftentimes have the opportunity to shout out staff people who do a good job. And then I saw her in the news in her interview. I was saying what a great job she did. I did not know.
Surprise.
Thank you so much.
I hope you feel this, because like I said, I've been sitting with him for a long time, so for him to be this choked up, I hope you feel it.
Well, we're also moved by your heart and spirit and feel so blessed for you to be leading something that touches our residents in such an important way. So I'm just so thrilled for all of us that we get to have you as our leader. So thank you.
Commissioner Griffin.
You know, we kind of kid and joke about being cousins, since my mom's from Macon, Georgia. But I felt your sincerity from the very first day I met you. I've recognized your professionalism by observing you over these years. And I couldn't be more happy for you and your family and for what you will do for the residents of Mecklenburg County and the state of North Carolina. God bless you.
Commissioner Leek.
I'm almost speechless to recognize the growth that a mother has produced, and father and family has encouraged, and your church family. Thank you for being in Mecklenburg County. God knows we need you, because we are in serious trouble health-wise all across this country now. So whatever you have, give it to us. Afford us to know who you are and with whom you serve. Thank you for your time, your energy, and Mother, thank you for being an excellent mother to your baby. I'm calling her your baby, and that's what she is for you. God bless you as a parent. It can happen. Some people say it can't, but the evidence is there. And a black woman, she's a pretty black woman.
Commissioner Meyer.
Dr. Scott, congratulations. There could not have been a better choice. You deserve this. I'm so excited for this county. We are in great hands. And to the manager, thank you for seeing her value.
I mean, well, how can I add to all those? We all feel it, and we've gotten to know you, and I just want to say I'm a big admirer, and I know that you've got this. I feel so confident in your ability and in your heart, and I really do. I don't know. I just really see that this is going to be an amazing opportunity for you and for us. So thank you for what you do and what you bring to this.
Well, thank you, colleagues. Dr. Scott, obviously, this board and the manager and this entire community has tremendous faith and confidence in you. We have since the first time we met you. It's continued and it's only grown. To see you where you are now, I know what it's like when you have big shoes to fill and you're coming behind that, but like I've told you before, continue to be you. And I will say to your mom and your sister, thank you so much for being here. And you have just produced a tremendous individual, a tremendous person. And we are just grateful and thankful. And the last thing I would say is you really touched me when you referenced your dad. And as someone who understands that feeling, I can unequivocally tell you that his spirit is here with you today, and he is extremely proud. So thank you.
Congratulations,
Mr. Manager,
Dr.
we'll
Scott,
turn it back
to you
over
and your
to you.
family.